Empty sella syndrome, S, is a condition where the small bone cavity in the skull that holds the pituitary gland, called the sella turcica, looks empty on a scan. The gland is usually still there, but flattened or thin, like a pancake in a shallow dish. Most people with S feel fine and discover it by chance when imaging the brain for another reason. The main reasons for an empty sella are: primary S, the thin covering diaphragm celli over the sella is weak, so the brain fluid CSF presses down and squashes the pituitary, like a balloon pressing against a soft pillow. Secondary S, after events that damage or remove part of the gland, such as pituitary surgery, radiation, a tumor that shrinks, or a bleed infarction. These create space that later fills with CSF. Many people have no symptoms at all. When symptoms appear, they can include headache, feeling like a tight band around the head; vision changes, blurry or double vision if the optic nerves are nudged; hormone problems, tiredness, low appetite, reduced libido, or difficulty handling stress, because the pituitary makes less of its hormones. Imagine checking your battery level. Sometimes the pituitary still gives enough power. Sometimes it runs low, leading to those signs. Doctors find us by imaging. An MRI, or sometimes a CT scan, shows a filled with CSF sella looking like an empty cup. Blood tests, checking levels of thyroid, adrenal, growth, and sex hormones. Treatment focuses on what is missing. If hormones are low, doctors give replacement pills. For example, levothyroxine for thyroid, hydrocortisone for adrenal. Surgery is rarely needed, but if a tumor caused the empty space, it may be removed with modern endoscopic tools. Because primary ESS is mostly due to anatomy, there is little you can do to stop it. However, you can lower the chance of a secondary empty sella by protecting the head, helmet when biking or working in risky jobs, getting regular follow-up after pituitary surgery or radiation, managing chronic diseases like high blood pressure, which can affect blood flow to the gland, higher resolution MRI that can see tiny parts of the pituitary and tell if it is truly empty or just thin, endoscopic transsphenoidal surgery that is less invasive and has quicker recovery if a tumor needs removal. Studies on quality of life showing that many people with ESS feel better when hormone levels are carefully balanced, leading to updated guidelines for hormone replacement. Exploration of genetic factors that make the diaphragm celli weaker, opening doors for future preventive strategies.